Hi doctors! Nice to meet you. If you are new here, allow me to introduce myself. I'm Dr. Marina Lara and I'm the second biggest provider of Invisalign in Brazil. Yes, Brazil, South America. And now we are sharing with you our content about biomechanics using clear aligners. We have more than 1,000 cases treated and we have our course in Brazil and now around the world. And this video I will talk about the 10 biggest mistakes regarding clear aligners biomechanics, and I'm very sure that you should stay because I challenge you in the end of this video, if you have one or had taken one or more than these mistakes that I'm going to tell you. So please stay and please sign our channel, allow our notifications bell and give your comment, please. Even if you like it or if you don't like it, tell me please. Your opinion is very important for me. So let's start right now talking about the 10 biggest mistakes. As a teacher, I have been teaching ortho biomechanics from 20 years now, and the biggest mistakes that people are just having using clear aligners are huge, and now I will highlight the 10 biggest mistakes. The first mistake is not know about the palatal cusp curse. Yes, this problem that the palatal cusps of upper molars and premolars can cause and can do in the end of your treatment. Yes, a lot of people knows, a lot of doctors already knows that the posterior or open bite can be a problem in the end of the first set or the second set of aligners. But a lot of doctors think that this problem is because of the thickness of aligners. But most of the cases, the problem is because you have the palatal cusp touching in the lower molars. You have the interference, you have the occlusal contact of palatal cusps. And now we Sisters Emerald, we have a name for this, that it's called the Palatal Cusp Curse, because if you in the beginning of the treatment in the virtual setup, you must correct the root torque of the upper molars and premolars. You must give extra torque. You must give the root torque, vestibular root torque, the buccal root torque of upper molars and premolars to prevent this problem, to prevent the palatal cusp curse in the end of the treatment. If you just are not doing this, you will have posterior open bite in the end of the treatment because of the palatal cusp touching and putting an interference in occlusal contacts with the lowers. Okay, so this is the first mistake. You must know how to prevent this mistake, and this will be our next video. So stay with us, sign up for our channel, allow our notifications, and give your comments, and just give some like here because you will learn how to prevent this problem. And this is the first mistake. Okay, the second biggest mistake with clear aligners biomechanics, it's similar of palatal cusp curse, but is the problem of incisors. If you finish your setup in the beginning of the treatment, if you finish your setup allowing the contact, even if it's a green contact, if you allow, finish the clean check or finish the virtual setup, doesn't matter the brand of the aligner, if you allow the contact of the palatal surface of the upper incisors with the lower incisors. In the end of the aligner set, you will have a strong contact, a very strong, and this is not good because this will interfere again in the occlusal and will cause the posterior open bite again. So the second mistake, it is still about preventing the posterior open bite, and you must finish your setup with no contact, without contact of palatal surface of upper incisors with the incisor surface of lower incisors. You must finish the setup with no contact because this the aligners has a very strong force and have a very potential to uppers to make this movement with the incisors. So you must finish with no contact in the incisors, and then you will have a normal and regular contact in the end of the first set. Okay, so this is the second and very important mistake. Pay attention and make your virtual setups with no contact. Okay, even green contact, don't finish your clean check with green contacts, finish without contact, and in the real world you will have a very nice and smooth contact. Okay, let's go to the third mistake. The third mistake is very crazy important. You never can approve a case, approve a setup, or approve a clean check without check the root torque of incisors and canines. Don't trust that this torque, this root torque is correct. Most of the time this torque is not correct and can cause a problem and can tip and move the roots of your patient outside of the bone. Okay, pay attention because it's not necessary in most of the cases. If you have for example a class 3 case and you need to move the crowns of lower incisors back, you should move the crowns of incisors back and not the root to the buccal movement, okay, because this is different. So sometimes it's very common the robot or the artificial intelligence move the roots of incisors, lowers and uppers, move the roots for the buccal surface against the buccal surface of the bone, and this will create a very big problem, taking the roots outside of the bone, as you can see in this case and a lot of cases of our students here in Brazil. So please never press the button approve case without knowing and checking all the numbers in the table of the movements, and stay looking and pay a lot of attention regarding the root torque, and especially in the lower incisors. Okay, and maybe you will think, okay Marina, but how can I correct this? How can I change this? Okay, I will teach you this later in the next videos. Okay, now you have just stay aware of the 10 biggest mistakes and understand the problems that you can have, you and your patients, if you just don't know about these mistakes. Okay, perfect. The mistake number 4, it's about the upper lateral incisors. As I told you, we Sisters Emerald here in Brazil, we have some names, some special names that we give to remember our doctors and our students and help them don't forget about the important things. And the upper lateral incisors, we call this teeth as a soup. The upper lateral incisors are very difficult to get the control, for in aligners biomechanics. These teeth are difficult to have the control and to put them inside the aligners and control their position, because a lot of times they are very small, they have a round shape, and it's a challenging tooth to stay inside of the aligners. So stay aware of this problem, and please, we recommend use in 90% of the cases. We recommend the sash attach or the sash attachment that was created by Narcosis, by Dr. Narco, and we love because with this attachment we can control much better the position of the upper lateral incisors in any case, class 2, class 1, case that we need correct the smile curve, cases that we need correct the position, alignment position and everything. It's perfect, and we strongly recommend that you must use the sash attach in all of your cases, independently of the type of malocclusion. Okay, mistake number 5. Okay, mistake number 5 is about changing the attachments in specific situations. Guys, please don't forget that most of the time the artificial intelligence, they just doesn't know what is important and what is priority for you and your patient. So, for example, in class 2 treatments, it's very important you have the leveling of SP curve, the leveling of curve of SP. It's very important you change the attachments. Sometimes the clean check comes back with attachments for rotation, but the most important thing in the class 2 treatment is for you leveling the curve of SP at the beginning of the aligners in the fastest way you can, because if you level the lower arch, you can have a better class 2 mechanics. So it's not important correct the rotation of premolars, of lower premolars at this moment. The most important thing in the beginning of the treatment is leveling the curve of SP. So you must change, for example, the attachments, the rotation attachments for attachments extrusion attachments. So you must take off the rotation attachments and put rectangular attachments with the bezel face to gingival margin to make the extrusion movement happens better and faster. Okay, and there is some of other situations regarding attachments that you must change the attachment that it came with the clean check. You must change for attachment that is more related with the priority of the case, and pay attention on this, because this can make your treatment goes faster and improve your outcome result. So, and maybe you can ask me, okay, Marina, understand, and which are these situations? Yes, we will have another video talking about exactly the situations that you must change attachments, but now we are talking about the 10th mistake, and this is the mistake 5. Pay attention to the attachments and be aware, because you must change sometimes these attachments. Okay, mistake number 6. This mistake, it's about allowing the algorithm, allowing the robot make the IPR in the crowding teeth. Sometimes the IPR comes in the middle of the crowding, and you just don't have space to make the IPR in the correct way, and this is a very strong problem, and it's not good. So, and we strongly recommend that you must make the IPRs in one session, only one session. But you must choose your session and put the IPRI in the exactly moment that you have space to make this happen. Don't let the robot and don't allow IPR in crowding teeth, okay? Change the stage of IPR if necessary, but I think that is not good for you if you split IPR in a lot of stages, a lot of moments. Try to put everything in the one session and one stage, but without crowding, okay? This is the mistake number 6. Let's go to mistake number 7. Mistake number 7 is about to that doctors that have problems with correcting rotation and correcting crowding because they are not using the explosion effect. So the mistake number 7 is not use the explosion effect. And the mistake number 8 is related with rotation also. It's about allow the software make the rotation using the central axis of the tooth. This is not correct, okay? To correct the crowding and correct the rotation, you must first using the explosion effect. Ask to the technicians, please open 0.2 millimeters in the interproximal surfaces of all the teeth that I want to correct, and then after you open the space, you have the explosion effect. After that, you must start with the movement, but it's very important that you must use the door movement, changing the axis of the movement to the distal or to the mesial, never in the center, in the long axis of the tooth, okay? Because the tooth with the aligners are not rotating in the long axis. They just make the door movement outside, open or closing the door, never in the long axis. Remember that, because these are very common mistakes. This mistake number 7 and number 8. Number 7 is not using the explosion effect, and number 8 is not using the door movement. It's allow the software make the movement in the long axis, that this is not predictable and is not going to happen, okay? Perfect. Mistake number 9. It's number 9, but it's not less important than others, okay? It's maybe the most important mistake. It's about staging. Doctors, please, if you just don't understand and don't make your modifications in staging pattern, I mean the movement and the staging of the movement during the timeline of the aligners, you will have problems in 50% of your cases, okay? Because most of the cases, they just come back in the virtual setup with a crazy staging pattern, and you must change that. For example, this case of our students is a class 2 case that she approved with staging without the V pattern, without the correct staging to treat class 2. And what happens? The patient used 3 sets of aligners and no movement occurred, no result, okay? So be aware and stay thinking and education, and try to find information and education, maybe here with us, about the correct staging pattern to treat each kind of malocclusion, because there is a very easy pattern for each malocclusion that we know that will work, okay? And a lot of cases, about 50% of the cases, they are not coming with this staging pattern correctly, okay? So stay with us. And now finally, the mistake number 10. Mistake number 10, it's make appointments and make little appointments giving the aligners to the patient without checking and without actually treating the patient. I could notice sometimes that the doctors that are in the beginning of their learning curve about aligners, even the experienced doctors, it's strange because sometimes it's just because we change to aligners, we just are giving the aligners to the patient without actually look the patient, without taking photos, without checking if the movement is happening, without making the step-by-step of all things that are very important to check and to do in an aligner appointment. So in the aligner appointment, you have a lot of things to check. You have to check occlusal contact, you have to check occlusal interference that can have problems during the treatment. You have to check the attachments, you must clean the attachments. You have to make, if you have a scan, you must scan to check the evolution of the treatment. You must have pictures to compare the evolution of your patient. You must engage your patient in the treatment. There is a very strong list. If you want to know what is our checklist regarding what you have to do, think and talk in the appointments, please give your comment here and we can send to you, okay? So stay with us, because and just don't do little appointments just giving plastic to your patient, because your patient, you think that is very easy treat with aligners, and it's not. It is a complex science, and it's your responsibility deliver the best result and the best smile to your patients, okay? So nice to talk to you. We talked about the 10 biggest and most common mistakes regarding clear aligners biomechanics, and in the next videos we will deep dive in which one of this, okay? And now I want to share with you a little bit about Sisters Emerald in Brazil and in all over the world. This is our online platform. It's a very strong platform where we teach all details about orthodontic biomechanics with aligners, all subjects and all kinds of malocclusion. And these are our course, our live course that is happening in Brazil and some places of the world. So if you want to stay with us, stay in touch, give your comment, and I will send to you our appointment checklist, okay? Bye bye.